My research focuses on the molecular and cellular regulation of wound healing with a special focus on causes for impairing healing that leads to a class of wounds called chronic wounds. The intention of that knowledge is to understand these molecular imbalances and then to design and develop new technologies and approaches that correct those imbalances and allow wounds to heal. Some patients that have additional underlying factors such as diabetes or who might be quadriplegic or paraplegic injuries and are confined to a wheelchair. These types of patients have a difficult time healing acute wounds. If those wounds develop a type of bacterial growth called bacterial biofilms, then they're at extremely high risk for severe outcomes. We encounter bacterial biofilms every day, and a good example of this are the plaque that forms on your teeth, where a single planktonic bacteria eventually attaches to the tooth surface and produces a large amount of extracellular matrix or slime. And as these communities of bacteria develop this biofilm, they become very tolerant or resistant to our own body's immune system as well as to exogenous antibiotics or antiseptic solutions that normally will kill single planktonic bacteria very effectively but are very ineffective at killing bacteria when they exist in these communities called biofilms. One of the major disadvantages in trying to understand the role of biofilms in wounds is to develop a laboratory model that reproduces the properties of a biofilm, especially growing on skin. So my colleagues, Dr. Priscilla Phillips and Ms. Qingping Yang, worked to develop a model that uses fresh pigskin explants. We sterilize the skin, we create deep partial thickness injury in the skin, and then we inoculate it with a series of bacteria that are common pathogens in skin wounds. After about 3 days of growing in the lab, the single bacteria have converted into a biofilm community. And then we study the different treatments on killing and dispersing the biofilm. A recent development from that model was the identification of some wound cleansing and disinfecting solutions were very effective at killing biofilms. The most effective treatment that we found is actually a product provides sustained release of iodine. The publication of that information has really changed the standard of care around the world for treatment of chronic wounds with biofilms.